Good afternoon. We don't have a lot of time, but this is a quick skill and rundown. We're going to talk about Narcan, and we're going to talk about briefly the opioid overdose and poisoning epidemic, which I'm sure you are all aware of, seeing it on the news. So we've handed out a sheet of paper that has just some facts about some of the narcotics that are available either via prescription or sold illicitly on the streets. The one that you've probably heard the most about is fentanyl. It is run pretty rampant around the nation and caused a lot of attention and a lot of overdoses, both intentional and unintentional. And I prefer to kind of refer to some of those as poisonings because a lot of times someone may not be seeking that particular drug. They may be seeking something else and unintentionally get that fentanyl instead and have an overdose. So I want to encourage you to think about this as something that can affect everybody. So these opioid overdoses and poisonings can affect everybody from 110 years old to newborn children, okay? I am the mother of 2 kiddos who are in school, and the way that I talked to my oldest kiddo about this, because I was dropping him off at football games, at the stadium, and he's a really great kid and he makes good choices and he's got great friends, and obviously I'm proud. But I would tell him always, you cannot ask anyone for a Tylenol or an ibuprofen and take it, because we are not sure, and sometimes even that person is not sure whether or not that may be laced with something that is deadly, such as fentanyl, okay? When we talk about other populations, individuals who use prescription pain medicines for a surgery or for chronic pain, sometimes the fentanyl patches, it's important to have Narcan because it can reverse the effects of that medication should that person take too much or should they just have some sort of poor response to it. So that's what we're here to talk to you about today. We also have on the back table some Narcan for you to take home, which might sound a little bit scary, except it's not, because it's an incredibly safe medication. You can buy it over the counter at CVS, Walgreens, Walmart, H-E-B, and it's not going to hurt anyone or you if it is used and it is not needed. So it's very, very safe. How many of you utilize some sort of nasal spray like allergy medicine or decongestant or something like that? That's how it works, okay? Very, very simple to use. We're going to show you a video in a minute that shows kind of the symptoms of what to look for someone who may have overdosed and how to give Narcan, but it looks like this. It comes in a box. The boxes back there are just taller than this. And there's 2 of them in there. Sometimes it might take more than 1 dose, depending on what that person has ingested. So you put this little tube thing up in the nose. There's a little red button on the bottom. This is a sample one. And you just depress this plunger and it gives the medication in that person's nose, and then you take it out. Very, very simple. Sometimes you might need to give more than 1 dose, which is the reason that there are 2. This video is also going to cover some things to look for someone who may have suffered an overdose, but the big things are anyone who is looking like they may not be breathing well, they may not be answering questions well, there's some sort of alteration in their consciousness, their pupils might get really, really tiny, their nail beds might turn kind of blue. Those are things that you want to look for, and just remember that if you have Narcan and you suspect that there's any reason this person may be suffering from an overdose or a poisoning, that you can give them Narcan, and even if they are not, it is not going to hurt them to give it to them. That's what's really, really important. It's a very, very safe drug. You are also protected by Texas Health and Safety Code to give someone Narcan and not be held liable or accountable for the results of giving that medication. Okay, the state protects you legally if you do give it to them. Okay, we're going to watch the video. It is this one. Yes, ma'am. And then we'll have some time for questions.
Increase volume, and I can't.
The administration of Narcan for someone suspected of suffering an opioid overdose. Narcan is also called naloxone and is not harmful if given to someone not experiencing an opioid overdose. Some common opioids you could come across are fentanyl, Percocet, hydrocodone, heroin, and more. First, how do you know someone is suffering from an opioid overdose? Not acting normal or unable to speak, their body goes limp or unable to wake them up, their breathing stops or is very slow, their face is extremely pale, have blue or purple color, they have pinpoint or very small pupils, their fingernails and plain skin, or if you have any reason to believe the person may be suffering from a fatal overdose. If you see any of these things, do the following. Call 911, grab the Narcan, remove the Narcan from the box, peel open the package containing the Narcan spray, hold the Narcan with the first finger and middle finger on either side of the nozzle with the thumb over the red plunger. Tilt the head back and while supporting the neck, insert the tip of the nozzle into one nostril until your fingers are against the bottom of the nose. Press the red plunger down firmly to give the dose of Narcan. Remove the nozzle from the nostril, turn them on their side, and watch them closely. If they do not respond by waking up, starting to breathe, or respond when you touch or talk to them, another dose may be given. You can repeat these steps every 2 to 3 minutes until they respond or emergency help arrives. If needed, start CPR and get an AED. You have now learned how to administer Narcan to someone suspected of suffering an opioid overdose. To find more information about Narcan and where you obtain it, here are some resources. Bluebonnet Trails Community Services, Williamson County EMS Community Health Paramedics, your local pharmacies, morenarcanplease.com, narcan.com, Substance Abuse and Mental Health Services Administration at samhsa.gov.
All right. That was our old medical director doing a presentation for us. Dr. Benold, anybody know him?
His wife's in this group. She just left.
Oh, did she just leave? I didn't even see her. Awesome. So again, Narcan is safe. It is intended to use for anyone you may suspect of suffering from an overdose or a poisoning. Again, we have boxes of Narcan in the back that you can take with you. As far as temperature control goes, we encourage you to not leave it in your car because we live in Texas. And so it might get really hot. It's not going to make it dangerous. It just may affect the efficacy of the medication should you give it. So if you want to take a box when we get ready to go after you do CPR, it's back on that table. All that we ask is that you just provide us your name on the piece of paper. We're not going to contact you and try to sell you anything or do anything, but we just like to keep a record that we provided this education. Are there any questions on overdoses or Narcan? Yes.
This works on any overdose, not just fentanyl?
It works on any narcotic overdose, opioid overdose in particular. So that list there that has those medications, some of those are prescription medications, some of them may be seen illicitly. That is a list of opioids that it works on. There's also a QR code on the bottom of that sheet that links to this video. I know it was quick. If you want to go back and watch it, share it with your family members if you're going to have this in your house, just so that they know how to use it and what to look for. That's a good idea to share that with them also. That's our public facing video. Yes, ma'am.
Mom, I have a question about this fentanyl type situation. So I don't know a whole lot about it, but from what I do know, it's very deadly if you touch it. So should I be touching someone that has touched fentanyl to give them Narcan? Should I be wearing gloves?
So that's actually a bit of a myth. So fentanyl is not readily absorbed just through the skin. So it is perfectly safe to touch someone who has suffered an overdose and provide them with this medication. What actually is a little bit more unsafe is that someone who wakes up after this may be feeling a little grumpy because it is a very sudden wake up that they have, and they may be disoriented, which causes them to maybe, do some of this action, right? Sometimes they also may vomit after receiving this. That is okay. That's why we put them in the recovery position so that their airway is safe. The instances that you are actually talking about are related more to the carfentanil and the fact that it is a much lower dose. That's actually a large animal tranquilizer, and it gained a lot of attention, but it is not something that is really seen very much. But if you see someone suffering from an overdose, it is okay to touch them. We touch them all the time. As EMS folks, we do wear gloves, but it is not readily absorbed through the skin. So the stories about picking up a dollar bill that's laying on the ground at a corner store parking lot and someone suffering an overdose because it had fentanyl on it, that's a myth. So, did that answer your question? Okay. Yes?
If the first dose isn't successful and you want to try the second dose, should you use the other nostril or does it not matter?
Yeah, you can. It's not going, you don't have to, but it's a good idea to use the other nostril. Sometimes people have like deviated septums and stuff that may hinder a little bit of the absorption. So if that first dose didn't work, you can switch to the other nostril. That may be the case with that person. Other questions? Yes?
So if Narcan is given and they wake up and they're answering and they're breathing, should we still continue 911?
Yes. So as the video instructed, you need to call 911, have someone call 911. It's really no different than kind of what Stacy's going to teach you with CPR. You're going to get someone to call 911. If you noticed in the video, that Narcan was inside an AED cabinet. Did anybody notice that? So our team, along with Stacy's team at Public Education, have worked to put Narcan into AED cabinets because I think it's important if you're going to grab one life-saving piece of equipment that you should grab the other one also. So you can grab both of those things, that way you're prepared. If that person doesn't wake up and they lose a pulse and we need to use an AED, we have that there as well. It's also just a really good place to look for something that might save someone's life because people are familiar with AED cabinets, right? So in the school districts across Williamson County, there is Narcan in the AED cabinets. If you go to any school in Georgetown, elementary all the way up to the high school, and you find an AED, there is Narcan with it. Round Rock, same thing. I mean, we have pushed this stuff out all over the place. In all your county buildings, in our city partner buildings, there is Narcan with the AEDs in most of those buildings as well. So when you leave here, take a look by where the bathrooms are. That's where our AED cabinet is. It says Narcan inside, and there's a box of Narcan sitting in there. Any other questions? No? Okay.
Thank you, Amy.
Yes.